Okay, we are live with Dr. Vinita Dubey from Toronto Public Health. She is Toronto's Associate Medical Officer of Health. Welcome, Dr. Dubey.
Thanks for having me again.
Thank you for being here again and answering all our questions. My name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. We've had so many questions come in for Dr. Dubey. She's very, very popular on our page. So Dr. Dubey, are you ready to field some questions today?
Yeah, for sure.
All right, so let's get started. Today, once again, we have a lot of questions about testing. Let's start with this one from Virginia Day. She says, why are we not testing asymptomatic people? Because asymptomatic people can carry the virus. So basically, why aren't we just testing everybody?
So the first news that I have to give you is from last week to this week, we have really great news in that now the testing criteria have actually opened up in the province. So anyone who has symptoms, even if they're mild symptoms, but they're new, then they can actually go for a test. So if you have a sore throat, it hasn't gone away, it's a new sore throat, you can actually go to an assessment center and get a test for this virus. And so that's really good. We know that the testing everyone who has no symptoms might help us to find a few people who are asymptomatic, but generally when you're asymptomatic, 2 days later, 48 hours after being asymptomatic, if you test positive, you're going to get symptoms anyways. The proportion of people who are truly asymptomatic and spreading in the population is actually not as high as we think it is. It's something that we're testing. We've actually tested now most people in long-term care homes, and we found a very, very small proportion who tested positive and were asymptomatic. By and large, most people who test positive have symptoms, or if they're asymptomatic and they're tested, they have symptoms 48 hours later.
Okay, so what you're saying is if I get tested today, I might not show up as positive, but a few days later I could.
And that's the other thing, exactly. So you could test negative today, but it doesn't mean that you don't have the virus that's incubating within you. And so 2 days later, if you get symptoms and we test you then, you could be positive. And so that negative test is only good on the day that it is done. And if you test negative today and you get results 3 days from now, it does not guarantee that you're negative 3 days from now.
Right, so testing everybody then doesn't really give us any indication of the spread of the virus or how many people have it or anything like that.
That's right. And I think we need to be careful about using our tests properly. And so I'm really, really pleased that we now actually are testing everyone who comes who has symptoms. Sometimes if you're a close contact, you know, someone in your house had symptoms, they test positive for COVID, you know, there might be certain circumstances where we might test people who don't have symptoms yet, for example, in a childcare setting or in a long-term care setting, but to go to every single house, every single person in Ontario and to test them right now is not part of the strategy.
Okay, so related to tests then, our own reporter, Erica Natividad asks, how soon after infection can the virus be detected by a test kit?
So if you have been exposed to someone who has the virus, it can take anywhere from 2 to 14 days for you to develop symptoms. Most people will develop symptoms 5 days after they've been exposed. And you're more likely to test positive for the virus within that 1 to 2 days before you develop symptoms and the few days after you develop symptoms. That's the kind of peak period when you might have more virus and test positive for this infection.
Okay. Next up, we've got lots of questions about opening up. What is your stand regarding libraries? We're hearing that libraries are allowed to open now, but shouldn't common resources still not be used?
Libraries are allowed to open for pickup and drop-off purposes. So you could order your books in advance and go to the library to pick them up. You could also return library books, but libraries are not open in general for the general public to use as we were previously used libraries.
Okay. Next up, it's another question about testing, but it's slightly technical. Diane says, I have a question about testing. With the PCR tests, from what I've read, you're testing for the RNA sequence and not the virus itself. Is that correct? And similarly, the serology testing indicates the presence of antibodies, but could those antibodies be from past infections other than specifically from COVID-19?
Yeah, these are good questions about testing. So because COVID-19, the disease is caused by a virus, usually we use, the virus actually only lives in a host, we call it. It actually doesn't necessarily live on its own. And so when we test the swab that goes to the back of the throat, it's an RNA test. It tests pieces of the virus. It's not a viral culture, so we don't actually take it and see if we can actually grow the virus. So absolutely, we're looking for pieces of the virus, and that's why actually when we test someone who's had COVID-19 and we test them a week or two later, sometimes that test is still positive, but it doesn't mean that they're still contagious. It just means that we're picking up, again, these small particles of the virus, these RNA, and that's what's showing up in the test. So that question is correct in that way. The other thing about antibody testing, yes, the antibodies just show your body's response to this virus. And we know for other viral infections that your antibodies can sometimes go up and doesn't always mean that you actually have the virus. And so that's why it's really important with all of these antibody tests that we understand, what does it mean when you test positive? Does it really mean that you actually had this infection? Is it a marker of, in general, that you had a coronavirus infection, but maybe not COVID-19? These are all the questions that we need to be able to answer about antibody testing as well.
And so again, once again, we've got tons of questions, just the same one over and over. Are we testing for antibodies? When will Toronto be testing for antibodies?
So Toronto Public Health uses testing guidelines from the Ministry of Health. The Public Health Agency of Canada, our federal body, Health Canada has approved one test in Canada, and we're getting guidance now to know what is the utility of using antibody testing. It has to be made available first in the province before we could provide it, and we have to be able to understand how we interpret these tests. And so these are forthcoming.
Okay, so we've got a few questions about treatment for the virus. Socrates asks, what is your stand regarding a treatment with a quote unquote shotgun therapy? Hear me out. He says, is shotgun therapy, by that he means like a broad spectrum viral drug that just treats various diseases, to give the desired outcome, because obviously there's no specific treatment for COVID-19.
So I'm not, I don't work in the ICU treating COVID patients, but from what we know, there is no specific drug for this disease. And so the idea of, using, well, let's use all of our viral drugs and see if they will work on this disease. There are trials that are being done, and we can't start, using every single drug in the book for every patient and hope that it will work, because each drug has its own side effects. And so we have to be careful in the kind of drugs that we use, and we have to use drugs that work. And so we're waiting for some of the results of some of these studies that are being done worldwide to be able to say, well, this drug works, and so you can use it, or this drug doesn't work. But right now, there isn't a drug that's on the market that can use this, that's available for everyone. But what we can do is we can treat the symptoms, and we can help someone who's had COVID-19 by treating some of their symptoms, by helping them breathe if they need breathing, to help them to overcome it.
Okay, we have a question from my fellow web writer, Christine. Christine asks, with the number of cases in Ontario now seeming to level off, but still not really dropping below 300 a day, what does this tell us about the spread of the virus? Are we actually containing it?
It means that we still have virus that's spreading in our community. And, again, we're balancing putting measures in place and relaxing measures while we're trying to reduce the spread of this infection. And so one of the key features that we need is we need to be able to have good public health measures when we identify a case to be able to then isolate that person and to be able to isolate their contacts.
Mm-hmm.
And so having more testing is going to be helpful. We actually will probably see that the cases will increase because now we're going to be testing more, but it means we're going to be able to find people sooner to put the individuals that they've had close contact with in isolation so that we can help prevent the spread. But ultimately, what it means is that we still have virus spread, and so we still need every single person to do their part to help prevent the virus from spreading in our community.
So a related question then from KR. He says that a while back, Premier Ford had said that we wouldn't start phase 1 till we were down to 200 cases or less a day. And right now, again, we're still ranging between 300 and 400. Is it safe then for us to go into phase 1? Why are we opening things when we still have such high numbers?
This is something that we're evaluating too, and recognizing that the cases in Toronto may be very different from other parts of Ontario. And our message is what we need to do in Toronto to help prevent further spread in Toronto may be different from what's happening across Ontario.
Mm-hmm.
I think what we can say safely is that in Toronto, we still have cases, and the cases, while they seem to be declining, we still have spread in the community. And so while we're relaxing some measures to be able to start opening up the economy,
mm-hmm.
it doesn't mean that people can start going back to their old routines. And it definitely means that we want to be able to avoid non-essential trips, to still, while you should go out for exercise, you should still stay home as much as you can. And you still need to keep that 6 feet distance and wash your hands often, because exactly, we still have virus that's being spread in our city, and we want to be able to prevent it from increasing too much more.
So on the subject of community spread, then we have another question regarding how and where in the community is this spread coming from? Is it workplaces? Is it healthcare workers? Is it on public transit? Do we have any idea of how and where in the community this is spreading?
We still know that about 30% overall of our cases have a close contact identified, either someone they work with or someone that they live with who they know has COVID, and we've been able to make that link. Mm-hmm. About 30% of our cases are related to institutions like long-term care homes or retirement homes. And then 5% are related to travel. And again, those were associated early on in the outbreak. For about 20% of the cases, we're missing data. So we don't know, either it's unknown where they got it from, or we just haven't, the information is pending. And then the last bit are related to being spread in the community.
Okay. Here's a question about hand washing and face touching. KO says, don't touch your face, assuming it's covered in the virus. So what's the correct way to clean your face without infecting your nose, eyes, mouth, both at home versus in public?
So if you were to wash your hands before you clean your face, then your hands would be clean, and then you could clean your face. So that would be fine. But the idea is that if you've touched a surface and your hands may be contaminated, and then you touch your face, if the virus is on your hands, it can then get into your body that way. So cleaning your hands first before you touch your face will be a safe way to clean your face.
Right. That makes sense. That's just common sense, I suppose. First, clean the instruments that you're using to clean your face with. Makes sense.
Yeah.
So one of my, again, fellow co-web writers, Meredith, is asking once again about masks. What is the proper way to actually handle and clean a cloth face mask?
So using a mask properly is actually really, really important. And so before you put the mask on, you actually want to clean your hands, because you want to make sure that if you have any germs on your hands, you're not getting them into the mask. Yes. Then you want to apply the mask. You want to make sure that it covers the nose and the mouth, and you want to make sure that it goes back to the ears, and so that it's tight fitting. There's no gaping holes on the mask. When you use the mask through the day, if it gets soiled, if it gets wet or dirty, then you actually want to remove the mask and change the mask. And then when you're taking the mask off, you want to take it off from the ears and put it directly in a laundry bin or something that's lined, or a bag, to then be able to wash it. And you want to make sure that afterwards you wash your hands.
And when you're washing the mask, just hot soap and water, disinfectant, what can people use?
Yes, if you launder it with your regular laundry, hot water with a hot water cycle and laundry detergent, that would be enough to clean it. If you want to hand wash it with soap with hot water and then dry it, drying it in a dryer is actually a good idea because the heat is actually a good way to be able to kill any lasting germs as well.
Okay. Related to masks, then, this is from Anonymous, but there have been lots of posts on social media talking about how masks actually might be more detrimental, not so much in the sense of touching your face, but the fact that they limit oxygen flow and can result in things like brain damage and death. We've seen a ton of these posts on social media. What is your opinion on that?
So masks are really good to keep your germs to yourself, and that's why we're strongly recommending them. But we recognize that there are some people who cannot wear a mask because of medical reasons.
Yes.
If you have, a respiratory condition where making a mask makes it difficult for you to breathe, you should not use a mask. Likewise, children 2 years of age, under 2 years of age, should not be using a mask because, again, they may find it difficult to breathe with a mask. In general, if you can't put a mask on properly or take it off, or if you find it difficult to breathe with a mask, then you should not be using a mask.
But in general, if you're generally healthy, you have normal breathing, is there really a risk of reduced oxygen flow due to cloth masks?
If you know the mask set can then be safely used, but if you feel like you're finding it difficult to catch your breath or to take a breath with a mask, then it probably means that you cannot tolerate that mask. Sometimes changing the mask, finding one that fits you better might be appropriate as well. But wearing a mask in general, and if you can wear it properly, you can still actually get good oxygen flow to your body.
Okay. Another question we have also coming in from an anonymous questioner. How long does the virus live on fabrics? The weather is warmer now, so we're not wearing coats and parkas and such, but we were just, up in February and March. Do we need to worry about disinfecting them regularly or dry cleaning them every time we use them? And if so, how often? Every time we go out or every couple of times?
So the virus lives on surfaces differently depending upon the type of surface. Mm-hmm. So a smooth surface, a stainless steel type surface, a virus might live longer on that compared to on things like paper products and maybe even on fabrics as well. I think the important thing is if it's a frequently touched surface, like a chair, for example, having chairs that don't have cloth on it so that you could wipe it down, especially a chair that would be used more often, is something that I would recommend. In terms of clothing, again, I can't give you a definitive, does it last for a couple of hours, probably not more than a few days on clothing. If you've though had, if you've been coughed on your clothes, if there's been some sort of contamination, then I would definitely recommend washing the clothes. Again, washing it with regular clothes and using a dryer would be effective.
Okay. We have a question now regarding underlying conditions. We've had a few of these. This comes from Concerned Diabetic. I have an underlying condition, which is diabetes. Even if the restrictions are slowly being lifted, should I start going out more, or should I continue to self-isolate? And the same question for her husband, who doesn't have an underlying condition, but would he be putting her health at risk if he was to go out?
So definitely, if you're older, because we know the virus affects older people, if you have an underlying health condition, if you got infected, you could get a severe infection. And so you should definitely take more precautions. Absolutely. And so just because things are opening up doesn't mean that everyone should go out. And so I think when you go out, you need to make sure that you take precautions. And if you can stay home, I think that's still a very safe thing to do. People who have frequent contact with those who have health conditions or who are more vulnerable, they need to be mindful of picking up the virus themselves, because you can definitely spread it more easily in a household setting.
Right. All right, so speaking of that, then we also have a few more questions. Again, since things are being allowed to open up, people are talking about visiting families, things like that. So Linda is asking, I want to get back to being with my family. If we all wear masks, would that be safe?
Right now, the provincial order is that you can only congregate in 5 or less, and that the recommendation is that you stay with your household. Until that order lifts, we don't have recommendations that you can meet up with friends or meet up with family members, even while wearing a mask. We'll have to wait for those provincial orders to direct us otherwise.
Right. And so then I guess this is probably the same question, but I'll ask it anyway. Evan asks, when then will we be allowed to have larger social gatherings like weddings, especially things like outdoor gatherings? Because from his understanding, the risk of transmission with proper physical distancing and masks in an outdoor environment is quite low.
It's true that in an outdoor environment, when you can keep your physical distance, the virus will spread less compared to, say, in an indoor environment. But we're still at, capped at 5. We can see that maybe that might increase. But as one of your earlier questioners mentioned, we still have about 300 cases a day in Ontario. And so we still have the virus spreading. And so we still have to take precautions. We still have to recognize that if we were to open up to weddings, that we could see that weddings might be a place where you could have spread of the virus. And I don't think any couple would actually want that for their guests.
No, of course. And so again, there's another question from Sess. I guess, again, we can just clarify. Could you clarify the distancing and isolation rule once again for us? Our household consists of my husband and I. However, we're wondering, again, if the max gathering group is 5, can we have our daughter and her family visit?
The mass gathering is 5, and so it means 5 total when you're in public. We're still recommending that you maintain your contact with your household members. We can see that as the virus the numbers start to decrease in Ontario, and we start to see less spread, that we could see that opening up a bit more. But right now, we're still at that recommendation.
So, sorry, just to clarify, it's 5 people in public, not in your home.
But we're still saying for your home that you should just stick with your household members.
Right. Exactly. Yeah. Exactly. So I mean, of course,
so, and the gathering of 5. I mean, it includes in your household as well. Like, you would not want to have more than 5. You can imagine that if you invited people who even 5 in your house, it would be difficult to physically distance as well. So in the house, I would say stick with your household.
Yes.
And again, the 5 limit is still ongoing right now.
Yes, and that's why I wanted to clarify, because within a home, you can have 5 people, but there's no way you're staying 6 feet apart.
That's right. Yeah.
Especially not in a condo downtown.
The footprint that you have is really important, and so that's why I think it's really important that we can get outdoors. We don't have to feel like we're contained in our house. We're definitely recommending for physical and mental health that you can have a picnic with your household in the park, in some green space. That would be fine. Picnic benches, those are open now. Picnic tables are open now, but we're still recommending that you stay with your household for a little while longer.
Yes. I think with the summer, people are just, crazy trying to meet their friends and trying to have picnics with everybody. And that's getting harder and harder to keep people indoors.
Agreed. Yeah.
Okay. So we've got a few more questions and just a little bit more time. So, okay. NMH asks, will the city be releasing something like a heat map to show which areas are worst hit with COVID-19?
We will start to look at some analysis by geography to see where in the city more people have, for example, gotten the virus. But what we know with this virus is just because you live in this part of the city doesn't mean that you got the virus in that part of the city. And so that's why the heat maps aren't necessarily that impactful, because it may give a false sense of security to say don't go to that part of the city, but all that means is that that's where people who have COVID live. It doesn't necessarily mean that that's where they got it from. Right.
And then let's see, we've got a couple of other. Okay, this one is actually from Kiera. Kiera says, this is again once more, people are very concerned about HVAC systems and like central air in their housing. Kiera says, I live in a basement apartment with a really old heating system. My landlord is having guests in and out, and I'm worried that COVID will spread through the vents. Is this a stretch? And also, if my landlord is using the laundry room that is located in the basement, should I suggest that he wear a mask?
with regards to the laundry room in the basement, we definitely would recommend that you keep the physical distance, that you clean the commonly touched surfaces. If he will come in contact with you, then a mask is recommended where you can't maintain that 6 feet distance. Again, right now the virus, there's no evidence that the virus is spread, that it lingers in the air. There has been some reports of the use of air conditioned, for example, in a restaurant. There was a report where the air of the air conditioning was blowing, it may have picked up the particles of someone and blown it in the restaurant. But there right now have not been reports that if you're in another room and someone with COVID was there, that you could have picked it up through the vent system. It's certainly something that we need to keep an eye out, especially as we may move to air conditioners, and different kinds of air conditioners may have different impacts.
Okay, and then this one I think we'll wrap up. But A asks, what options are available for anyone recovering from COVID at home but still seeing major symptoms or side effects? I called an ambulance when I had COVID. My breathing was very bad. The paramedic convinced her to stay home. Because all the ERs back then were only testing people with very bad symptoms. She now is continuing to have symptoms, but is not sure what to do, whether she can go get tested, whether she has to go back to hospital.
If you're having symptoms where you're having difficulty breathing, you're having chest pain, you need medical attention, there's no question you should call 911 and get that medical attention. Mm-hmm. If you have symptoms of COVID, you can go and get tested. And so you can call ahead to an assessment center and make an appointment. When you do go to these appointments, when you have symptoms, we definitely recommend that you wear a mask, that you don't take public transit, that you get a ride, you drive yourself there if you can, or if you can't, to get a ride, sit in the back seat, wear a mask, and open the windows. Right. There are definitely, those definitely would be my recommendation. And if you have questions, you can also call Telehealth Ontario. You can also call our Toronto Public Health Hotline as well.
Okay. And then I guess we'll wrap up with this, because we heard yesterday that schools are out for the rest of the school year. When do you think then that it will be safe for staff and students to return to school?
We'll have to see what September brings. We'll have to see how this virus plays out in Ontario through the rest of the summer. It's really, really difficult to predict what's going to happen in September. Mm-hmm. And we can just hope that our, virus stops spreading in Ontario and in Toronto, so that we could see schools open. We can imagine, though, that even if schools open, that it won't look the same as it looked in the beginning of March when we were all in school.
Right. There's been a lot of talk about the new normal, whether it's schools or restaurants or workspaces. There's going to be different measures that we're going to hold on to for quite a while, I believe, even after things open up.
That's right. Until we have a virus or a good medication that can treat this virus, until we have a vaccine, we won't be able to, we'll have to keep our guard up to be able to help prevent the spread of this infection.
Okay. And then we have one very, very frustrated questioner who's talking about how not enough people understand the importance of hand washing as opposed to sanitizer. Could you reiterate that for us, please?
Yes, for sure. Hand washing is definitely preferred, and especially if you have visible dirt on your hand, you need to wash your hands to remove that dirt, and wash it with soap and water. Make sure that you lather for at least 15 seconds, so the total process will take about 20 seconds. If you don't have access to soap and water and your hands are not visibly soiled, then you can use an alcohol-based hand sanitizer, between 60 to 90% hand sanitizer, to clean your hands. And so that would be fine in that circumstance as well. Okay, so hand washing first, sanitizer second. Hand washing is preferred, but if you can't get to, a basin with water and soap, then hand sanitizer if your hands are not visibly dirty. Yeah.
Okay, good. She was very, very frustrated about that, because I think a lot of people just tend to replace actual hand washing with just alcohol, and that's not always enough to slow off anything that's actually on your hands. Okay, so 2 minutes left. I think we could actually squeeze one more in. Let's see. We've got Seymour asks, What about the idea that vitamin D can be effective in fighting the COVID-19 virus?
There are studies that are being done about this, and so we'll have to wait and see. I certainly wouldn't recommend it right now to say take vitamin D and it's going to prevent COVID-19. There's no evidence for that, but as we get more and more evidence, if that becomes a recommendation, then we'll be able to offer that.
And
I think vitamin D, I think what we can safely say though is that vitamin D is good for other things. And so especially in a climate like Canada where we don't get as much vitamin D through the sun, making sure that we all get appropriate vitamin D is important. But what I wouldn't say is I wouldn't link the use of vitamin D with preventing or treating COVID right now.
Right. And so then we've got 1 minute left just to wrap up. There's been a lot of talk about, of course, vaccines and, spread of the disease and things like that. What about building up immunity within oneself? Like maybe whether it's supplements, because we were talking about vitamin D, or is there anything else that people can do to just build up their own immunity in order to prevent actually catching it?
We do know that exercise is a really good way to stay healthy. Eating good food is another good way to stay healthy. Staying away from germs, doing what we can to keep ourselves preventative from these infections is also really important.
Okay, thank you so much, Dr. Vinita Dubey, for joining us again today. That was, again, very informative, and hopefully we'll see you again soon.
Okay, my pleasure. Have a good day, everyone.
Thank you. You too.
Okay, bye-bye.